In this question, we have a 14-year-old boy. He's having frequent nighttime urination as well as occasional headaches. His family immigrated from Cameroon. His father diagnosed with sickle cell disease at age 5. He has a normal physical examination. A hemoglobin electrophoresis shows hemoglobin A 55%, hemoglobin S 43%, hemoglobin F 1%. The question asks, this patient is at increased risk for which condition? Now, based on the electrophoresis findings for this patient, we know that he has sickle cell trait. Now, if we go to this slide, with sickle cell disease, because there's going to be mutation in both hemoglobin genes, we're not going to have hemoglobin A. Instead, we're going to have 90% hemoglobin S, 8% hemoglobin F, and 2% hemoglobin A2. In sickle cell trait, we're going to have a one functional hemoglobin gene. As a result, we're able to produce the normal hemoglobin A. So we're going to have 55% hemoglobin A, 43% hemoglobin S, and 2% hemoglobin A2. So because the patient has hemoglobin A 55%, as well as hemoglobin S 43%, these are all going to be consistent for sickle cell trait. Now, sickle cell trait is going to be a lot less severe than sickle cell disease because there's still a functional hemoglobin gene. As a result, patients can still produce normal red blood cells. With sickle cell disease, most of the red blood cells are going to have that sickling shape to it. So the red blood cells are going to look like this. And so because these red blood cells that have this sickling shape to it can occlude blood vessels, so imagine that this is a blood vessel, and imagine that these are sickled red blood cells. So these can occlude blood vessels. So now there's not going to be blood going to this area to perfuse it. So now there can be ischemia in this region. Now, because in sickle cell disease, most of the red blood cells have this sickling shape to it, they're going to be at a higher risk for developing severe conditions like avascular osteonecrosis, which is going to be answer choice A. They can have splenic infarcts that can result in functional asplenia by the age of 5, as well as being at a higher risk for developing ischemic stroke. Now, patients with sickle cell trait, because they have one functional hemoglobin gene, they're also going to be able to produce normal red blood cells that have normal shape. And so, but because they also have some sickled red blood cells, they can be at a higher risk for developing renal papillary necrosis, because renal papilla is going to be a region of the body where it's going to be at a higher risk for developing infarction in ischemic conditions. So because patients with sickle cell trait can be at a higher risk for being at an ischemic condition because of this, the fact that they can have some sickled red blood cells, that can be at a higher risk for developing renal papillary necrosis. So with renal papillary necrosis, here's going to be the region of the kidney. So this is going to be the renal papilla. And remember that the renal papilla is going to be a region of the kidney where it's going to be at a higher risk of ischemic infarction. And patients can present with gross hematuria as well as flank pain. I have a mnemonic that might be helpful for remembering some of the conditions associated with renal papillary necrosis. So the mnemonic is sad papi. Papi means dad. So here's a picture of a sad father. So the S is going to be for sickle cell disease or trait. The A is going to be for acute pyelonephritis. A is going to be for analgesics, so NSAIDs. And the D is going to be for diabetes mellitus.